Hello, this is Mr. Neil Writer, consultant audiologist and director of Clearwax. Thank you for joining me in another demonstration video of our recently developed WAXscope, which is due to be launched in early autumn 2022. And in this procedure, we have a patient with bilateral occluding earwax, and I'm just using the 4.25mm speculum just to dilate the ear canal. The patient has got quite a narrow bendy ear canal, so the speculum helps to dilate that. So the eardrum's in the distance. I'm just going to quickly get that in focus. We can see all the blood vesicles there. So the vascularis of the handle of malleus. Now, just a bit of keratin on the cartilaginous portion. I just thought the patient's a hearing aid wearer as well, so I just wanted to prevent the soundboard, the wax filter, getting blocked by some of this more lateral dead skin. So I'm just mopping that up very, very quickly. And once again, it's just a tail of keratin there, but we've got the great magnification of the eardrum in the distance. And you can see how I've just changed that focus. One of the things that people often discuss about visualization techniques when they perform earwax removal is binocular vision, the ability to see the earwax or the eardrum using both eyes. And with an ENT microscope, the microscope artificially converges your pupils so they're closer together. I'll come back to the moment. You can just see that great view of the eardrum there offered by the WAXscope. And being able to see an object with both eyes, you can do it yourselves. You can almost, if you put your finger out in front of you in one hand and then close one of your eyes and try and touch it with the other finger, and then open up both eyes and do it, you will find that it's a bit easier with both eyes because both eyes are focused on the tip of your finger, and they send messages to the brain, and the brain can then calculate the depth. So binocular, the ability to see with both eyes a single object does give rise to depth perception. So an ENT microscope can offer that, and there's some head loops that can also do that. But when we use an endoscope, for example, there is no binocular vision. You're just viewing the wax on the eardrum of a 2D screen. That doesn't mean you don't have depth perception with just looking with one eye in actual respect, because it's almost like a cyclops vision. You use, it doesn't matter you've got two eyes, you're just viewing it off a flat screen. So with an endoscope, you can also get depth perception using monocular vision, so vision with one eye. And I think we've done over thousands of videos now with an endoscope, and you can see that for yourselves. You just use different cues. You use shadows, landmarks of the ear, because of the great view offered by the endoscope. But one of the things I've realised more and more using the WAXscope is another mechanism of developing depth perception is focus. And you've seen that previously with the other ear. When I first removed the wax, which is more in the lateral part of the mid canal, the eardrum in the distance was a bit out of focus. When I adjusted the focus, and I could see the eardrum in focus. So focus is another mechanism of giving you depth perception. So when, for example, the wax is out of focus, you kind of know it's probably a bit further away or a bit closer to you, so you adjust the focus, and as soon as you get that focus, you've got that depth perception. And so even with the instrument, when you're going closer to the wax, it gets more in focus. So it's something that I've realised with the WAXscope. So even though I'm doing this procedure off a 2D screen, I still feel that I've got complete control over depth perception. I've got some other videos where I'm removing some wax off the eardrum there, and it really does give rise to, it really illustrates the depth perception. So the WAXscope, as I said, it's going to be available to purchase early autumn 2022, and we're just busy with manufacturing at the moment. And you're going to have a view of the eardrum here as well. So again, you can see the blood vessels. There's a few hairs at the top of the entrance. So to register interest in the WAXscope, please feel free to email info@clearwax.co.uk. Thank you, bye.